4.5% of the primary ACLs that are done are going to re-tear.
4.5, okay.
About a third of those are from trauma, so it's nothing to do with technique or prior surgery. It's not too different than a primary ACL. There's about a 3% rate of athletes that are going to tear their ACL for the first time, native ACL tear.
Mm-hmm. Now, that would be non-contact, the original, but you're saying the percentage is that most of the time it's contact that's going to do that.
Yeah, the second ACL.
Yeah.
Yeah.
So if you look at it from that standpoint, you get back from, say, a second one. What is the level of play if you're a professional athlete or high school or college? Because there are a lot of folks out there that are wondering, that they're going through this that aren't necessarily professionals.
Sure.
What level do you get back to typically?
Very, very difficult. After a first ACL, there's about a 25% rate of not returning to the prior level of function.
Wow.
You can return to normal activities of daily living, but getting back to a high-level athletic career, very difficult in about 25%. And that number actually increases. It's more variable after a revision ACL because there's so many different factors that play into it.
So in other words, if you've had two, then it really, really gets dicey.
Makes it much more difficult.
Wow, that's certainly interesting
Sure.
right there. Now you look at it, how much quicker are athletes getting back from that now than, say, 15, 20 years ago? How much have we advanced in that from that standpoint?
Well, that's an interesting question. The limiting time factor is not actually technology or surgical technique, it's actually biology. So it takes these grafts about 3 to 4 months to fully heal and incorporate into the body, and then another 2 to 3 months to really get the functional strength and balance back before they can get ready to play.
Very interesting. All right, doctor, we appreciate it. Dr. Brad Bernardini from our sponsor, Virtua, talking about ACLs and the recurrence.